This panel is The Fight in Asia, Drug Policy Reform in a Challenging Context. And I am told that this might be the first panel at the Reform Conference on Asia. So we're breaking some new ground here, maybe. And I'm very excited for this very distinguished panel from across Asia, actually. There at the very end, we have Tripti Tandon, who is with the Lawyers Collective, based in India. Next to her is Goro Koto from Japan, who oversees the Japan Advocacy Network for Drug Policy Reform. Next to Goro is Ines Faria. She is from the Philippines and works for an organization called No Box Transitions. This is Ricky Gunawan, who works for a legal collective called LBH Masyarakat, based in Indonesia. And this is Ido Agustian, who is working for a drug users organizing collective, also from Indonesia. So to start, I was thinking, as opposed to going into a long introduction for each of you, I would let each one of you tell the audience what you do and why are you working on drug policy reform in Asia. Throughout this conference, lots of people have asked me, what are you doing in Asia? What's possible there? What are people working on? So I thought it would be best if each one of you could just take some time to talk about what you're doing and why you're doing what you're doing. What sort of is your personal fight in Asia and why are you doing it? So we'll just start here with Ido.
Thank you, Matthias. Yes, I'm a coordinator of PKNI, or in English, we can mention Indonesian Drug User Network. It's a national network of people who use drug in Indonesia. Our member now consists of 26 self-organized groups in 17 provinces. And what we are doing, yes, promoting evidence-based drug policy, doing advocacy, and to fulfill human rights for people who use drugs, and also doing field monitoring and evaluation for the services such as harm reduction services, community-based drug dependence treatment, and also we are providing HIV prevention among people who inject drugs, and also MSM and transgender in 12 provinces in Indonesia. So that's what we are doing right now.
Why do you do what you do? Why are you an advocate?
Why I'm working in this field, maybe, my background is I'm a drug user, and also there is an experience that changed my life, maybe. When I was drug user on the street, there is something very bad happened to me, and then start on 2007, I start to work on this issue.
Thanks.
Since this is a drug policy conference, there are two groups that particularly relevant with the work that we do, that we serve. First one is people who use drugs, and second one is drug offenders who are facing death penalty and executions. And when we first started this work in 2007, 2008, we first met with local drug users organizations called Stigma Foundations. And we had the Anti-Torture Day, June 26, which happened to be the Anti-Drugs Day as well. So in June 26, Stigma Foundation and the friends came to our Anti-Torture Day, which we organized, and they shared the experience that a lot of drug users have been tortured by the police, and no legal aid organizations willing to help them because of the stigma associated with drugs. Many lawyers, when they came to these legal aid organizations or other human rights organizations, they said, yeah, we're willing to help, but not in a sense of providing legal assistance. And for us, when we first heard that, it's just ridiculous. It's just nonsense, because it's a human rights violations, and we are committed to provide legal assistance to any kind of victims of human rights violations, regardless the background. And then when we first started in 2008, we started with providing legal education to drug users communities in Jakarta. So we first gave them human rights education, legal informations, and trained them to be paralegals to be able to provide what we call as first legal aid to the drug users communities. And then we are happy now to see 10 years after that, many legal aid organizations are starting to engage in drug policy issues as well. Although there are not many legal organizations still that want to provide legal assistance to drug users in Indonesia. The second one is drug offenders facing death penalty or executions. Our first client in 2008, who was on death row, a Nigerian guy. His name is Humphrey Jefferson. And so one time I wrote a piece for the Jakarta Post, and then after that, his colleague in Jakarta contacted me, and then we came to visit Jeff in Nusa Kambangan. Nusa Kambangan is an execution island in Indonesia. And then we heard about the case, and we knew that his case was fabricated, he was tortured. His court decision was racially biased, because in the court decision said that because you're black-skinned man from Nigeria, and Nigerian people often dealing drugs, then you must be dealing drugs. That kind of racist considerations as well. And when we first started, it was difficult, because drugs and death penalties are quite extreme issues for us to understand as a new organizations. But then we began to make friends with our friends at drug users communities. We go to the local health clinic. With Jeff, we began to understand about the relationship between drugs, drug law, and death penalties. Unfortunately, Jeff was executed last year. And I think that's more of a personal fight, because we see on the ground that there are no lawyers who are willing to help drug users, simply because they are drug users, simply because they are seen as garbage of the society. And for drug offenders, same thing. Many lawyers, many human rights organizations, they campaign for abolition, but they don't want to assist people facing death penalty or executions. So I guess that's kind of a personal motivations to continue this fight in Indonesia, at least.
Hi, good morning. So Ines from No Box, Philippines. So No Box was basically founded because the history of it is that before we used to have residential program embracing harm reduction in helping people who had problems related to drugs. And harm reduction meaning that it was a more user-friendly way of engaging with people and really understanding what concerns there are that and working collaboratively to address it. But then realizing that whatever gains may have been made in that particular setting, it becomes artificial, because when they go out, then society treats them the way a lot of them being treated now, with much stigma and discrimination. So it kind of undermines everything. So No Box is founded to address the socio-political environment, I guess you can say, in which drug use is occurring, in which treatment is occurring. And we wanted to also kind of change the course of conversation, to change the nature of conversation about drug use, to make it more nuanced and understanding there's so many intersecting factors that need to be taken into consideration. So, at No Box, we work in different layers. So we have worked with legislators in terms of drafting bills, like harm reduction bills. So there's one now in the Senate and the Congress. And then we also work a more experiential side of it, meaning working with communities, so local government units. So because, for example, because of the current administration where a lot of people have been forced to surrender, to report, but then, and local government units are mandated to come up with programs to respond to their needs. But we started from nothing because community-based programs did not exist before. So we're trying to help them develop kind of responses from a harm reduction perspective. And then on top of that, there is lack of evidence. So we're also going into research and building data and evidence because it's difficult to counter the narratives that's dominating the conversation now, where drug use equals criminal, equals violence, equals useless and non-human. It's very loud, so we really have to counter that. But despite the challenging environment now, there are actually spaces for it because where people used to not, if it didn't affect them directly, then they weren't interested in talking about drugs or anything about this. But now it's affecting almost everyone. So we're trying to capitalize on those spaces to talk about this. And the idea is to be able to contribute to changing the mindset, to contribute to putting in place certain responses and systems in place so that even after this current administration, whoever the leader is, we're trying to minimize the risk of this happening again. Because this mindset has existed even before the current president. And that's why it was easy for him to capitalize on this and use this against us. So, yeah, that's it for now.
Hi, good morning, everyone. I'm Goro Koto from Japan. I'm a director of Japan Advocacy Network for Drug Policy. We are based in Tokyo, and we are the only advocacy organization, drug policy reform in my country. But I'm the only paid staff, and I'm still part-time worker, so I don't know if should I say we or I, but at least I have some colleagues that I'm working with, and I have executive director, but she doesn't belong to my organization, but she works in the different kind of recovery facilities. But anyhow, so what we are doing is start to broaden our network itself, because we don't, again, I'm part-time, I'm working 1.5 days a week, and now I'm staying here 4 days, which means I'm already working for 1 month in my organization. So what I can do is very limited, but I need to do fundraising and broaden my network and have more people involved in my activities, because in my country we have no harm reduction programs. People don't know harm reduction, so every time I start to talk about what is harm, what is reduction, what is harm reduction, something like that, and it's very hard for many people to understand what it is. So we are creating like an education tools, mostly translating the materials from English to Japanese, and we try to disseminate that information by websites and creating our home pages. So that we are kind of right now try to start. And so why I'm doing this is, I was 10 years ago, I was a student in the master's degree of Columbia University School of Social Work, so where I learned harm reduction and advocacy. And I was fortunately had a chance to do internship at Harm Reduction Coalition and New York Harm Reduction Educators. So for me, I learned addiction from the harm reduction perspectives, and I didn't know harm reduction at all at that time. But when I choose my internship, my people said like, oh, this harm reduction is very hot now, it's new now, and I didn't know what harm reduction. I asked my friend what they are saying, what is harm reduction? I even didn't understand the meaning. But she said that she just explained to me, so she was very nice to me, and so I liked that. So I went to the faculty, and I said to the faculty, I came here to run harm reduction, something like that, and I got the position, and it was really fortunate. But when I came back to Japan, I didn't know anybody who I can talk with about harm reduction, but the person I met who are working in the recovery or rehabilitation programs in my country. It's totally abstinence-based, but they said so far we didn't believe that we have human rights because we know we did something bad and because we deserve this kind of situation. But they start to know like the situation in other countries, and they start to say like, but it seems not true, and we can also advocate of our human rights, advocate for our human rights. So we start to think, okay, let's learn more in the other countries, and let's try to advocate in my countries. So that's what we are just starting to do, and why I'm doing these activities. And so, and I expected one thing, because this is an international conference, so I may, if is any chance that I may see somebody from Japan to come this conference and to get to know and work together. So I'm just kind of wondering if there anybody from Japan. And not surprising. Yes, thank you very much.
Hi, my name is Tripti Tandon. I'm a lawyer from India. I work with an organization called the Lawyers Collective. It's one of the oldest human rights organizations in India. We're over 35 years old and work on a range of issues, including women's rights, health, HIV, intellectual property, access to medicines, sex workers' rights, LGBT rights, anti-death penalty, a whole host of areas of which drug policy and human rights is one. As a lawyer, I engage in litigation, both strategic litigation, which has a wider impact. We have challenged the death penalty for drug offenses in India. We've challenged, torture and mandatory treatment that drug users were subjected to. Recently, we challenged the inclusion of ketamine as a psychotropic substance, notwithstanding its medical uses for patients.